I have to say, this next story is one of my favorites of all time. So Rand Paul's a guy. I don't hate Rand Paul. I think you guys know that. He's a libertarian-ish Republican, and as everybody knows, I massively disagree with libertarians on all things economics related. But I agree with them on many things when it comes to social issues. If the libertarians or libertarian-ish folks want to end the drug war and legalize drugs, right there with you. If you want to do criminal justice reform, right there with you. If you want to stop regime change wars, right there with you. So there's actually there's many areas where libertarians and lefties can work together where we actually agree, and so we can work together for the common good in many areas. I think a lot of people have a dumb, principled objection to working with people who they disagree with on some stuff, and it's like, well, then nothing ever gets done. Nothing ever gets done. Because by definition, you don't agree with the other side. But if you find somebody on the other side who 40% of the time you agree with on certain issues, why not work with them on those particular issues? Fight them like hell on economics-related stuff, but on the other stuff, work with them. So this segment that I'm doing now is not coming from a place of malice, is not coming from a place of like, I'm out to get Rand Paul. It is objectively hilarious to me, the stuff that you're about to hear. So Talking Points memo says that libertarian Rand Paul is traveling to evil socialized medicine Canada to get surgery. Oh, Rand, what are you doing? Now, he's trying to rationalize this and explain this and it's not exactly what you think it is. It's capitalism. It's not socialism. Kiss of reasons and stuff and things, bro. Get at me, bro. Well, I'll give you the reality of it. So this is what they say. Senator Rand Paul will travel to Canada in late January to get hernia surgery related to the attack he sustained from a neighbor in 2017, according to the Louisville Courier Journal. Notably, Paul is adamantly against socialized medicine and has called the idea of a national public healthcare system slavery. Slavery. Canada enjoys publicly funded universal health care, but the hospital Paul will visit is privately administered, his spokesperson said. Communications Director Kelsey Cooper called Socialized Hernia Hospital a private, world-renowned hospital separate from any system, and people come from around the world to pay cash for their services. There is some nuance here, though. Though Socialized is a private for-profit hospital, it does almost all of its work under contract with various provincial governments. Thus, the majority of the hospital's income comes from patients who pay their bills through their government-funded health plans, according to the Globe and Mail. Canadian citizens pay into the country's single-payer healthcare system through federal and provincial taxes. Each province or territory has a healthcare plan under which they can get free care. What the country has is similar to the Medicare for All concept endorsed by some Democrats. So this is awesome. Do you understand the details here? Here's what they're saying. Rand Paul is going, everybody who's trying to hypocrisy burn me and say that, like, you know, I'm going to evil socialized medicine Canada to get surgery as I shit on universal healthcare all the time. Everybody's trying to say that about me. Here's why they're wrong, bro. It's like a private facility that I'm going to, so. Wrecked, bitch. Pwned. Yeah, but Rand, the overwhelming majority of healthcare facilities in Canada are private facilities. The operative point here is they are publicly funded. So that's a single-payer system. Listen, we've spoken about it here on the show before. There's different kinds of single-payer system. So you could do a UK-style single-payer system where you have public funding, so tax money goes towards public institutions. So in other words, it's public funding of public institutions, meaning that the doctors and the nurses and everybody is employed by the government. Okay, that's one kind of a single-payer system. Another kind of a single-payer system is like the Canadian system or the French system, where you have private services, so private doctors and private entities, private healthcare facilities that are funded with public money, so taxpayer money. So public funding of private institutions. Both of those kinds of systems are single-payer systems. He's trying to weasel out of his hypocrisy here by saying, bro, it's like a private facility, so whatever. I'm not a hypocrite. It's like a private facility, bro. It's a private facility, bro. It's a private facility, bro. Yeah, so are most of the facilities in Canada. The operative point is they're publicly funded. Most of the money at this facility comes from the government. And Rand Paul has said, in no uncertain terms, single-payer healthcare, that's slavery. That's slavery. That's all it is, bro. It's slavery. And there's no nuance here. That's not a ridiculous point, but it's definitely slavery. So, in other words, Rand Paul is going to a modern-day plantation where there are slave workers around him, and he'll be benefiting from them. Hilarious. So funny. Now, to be fair, he is paying out of pocket. And by the way, yes, it's true, and I spoke about this. I corrected myself afterwards as soon as I knew I made the mistake. When I was on Joe Rogan's podcast, I inaccurately stated, if you just go to Canada, you get coverage and you can get healthcare and it's free. Now, that's actually wrong. You can't, like, if you're an American, you can't just go and get coverage and it's free. You have to be a Canadian citizen in order to get the coverage and it's free. But what I was referencing was an article that said refugees get free healthcare, but I wrongly assumed that refugee just meant, like, if I drove up to Canada, which is only maybe 5 hours away from me, if I drove up to Canada, went in there and went to a hospital to get some sort of surgery or get some sort of health care, that I would technically be considered a refugee. Like, immediately. Like, yeah, I'm a healthcare refugee. I'm here. I want healthcare and it's free, right? No, you have to, like, there's a legal category of refugee that you have to be in before you get the healthcare. So I was wrong on that front, and I corrected myself. The free healthcare is for Canadian citizens, okay? That's true. But that's what's happening with Rand Paul here. He's traveling there to evil socialized medicine Canada. He's going to pay out of pocket a couple $1,000, maybe $5,000 or so, for a hernia surgery, and it's part of their single-payer system. Private facility, mostly government-funded, and he's paying out of pocket. So, if you really thought that there was slavery going on in this evil system, if you're so convinced that single-payer healthcare is slavery, then I don't know why you'd want to go get a procedure done by a slave, because these doctors, again, are mostly funded by tax money. It's a single-payer system. So it is hilarious. You are a hypocrite. No matter how much you try to weasel out of it, it ain't going to work. But actually, you know what? Here, final point is this. If Rand, let's say Rand is not as turned off by the idea of a single-payer system where it's private providers, private facilities. I mean, that's what he's about to get the benefits of here. So if you're not turned off by that, okay, then let's vote for that system here in the U.S. If Rand Paul's only objection on healthcare is the UK-style system, which is public funding of public facilities and public doctors, if that's the thing that you're most like, oh, that's the problem, but you're obviously fine with private facilities funded by tax money, well, then vote for that kind of system here. I'll take that immediately. I'll take any kind of single-payer system here in the U.S. I'll take a system that says each individual state, the federal government passes a law saying each individual state has to create their own state single-payer healthcare system. I'll take that. I'll take public funding of public institutions. I'll take public funding of private institutions. I'll take any version of a single-payer system. And listen, if your actions speak louder than your words, then what Rand Paul's actual belief is I don't consider it a single-payer system when it's public funding of private facilities. So I'm down for that. Okay, great. Let's pass that bill right now. I will immediately support that bill because, again, all of that is better than what we currently have in the U.S. And it seems like Rand Paul deep down kind of knows that.